So how are the basic MRI contrasts generated? So we'll start out here with proton density weighted MRI. So for proton density, just have proton density. One wants to minimize the effects of the relaxation. So I'll take again the basic equation here that we have, the signal as a function of TR, TE and TR. We want to minimize the effect of T1. So the T1 here is for different tissues. We don't want to have the effect of T1 on the signal. So we want, essentially what this means is one wants to measure at a TR that is relatively long compared to T1. So it's a long TR. In this example here, it's 3.5 seconds. That will minimize the effect of T1 differences. And let's pretend we have been good at that. So we can, by measuring here, we can neglect the effect of T1. So we'll just say this term here becomes 1 and we'll neglect its effect. So now we're left with the exponential decay here, this term here. And now we'll look at the signal decaying as a function of T2. Again, we want to have not influence of T2, so to have no influence of T2, we want this term to be essentially 0, T over T2. If T, or we can basically say if T is 0, then T2 can be whatever it is. It will not, e to the minus 0 is always 1. So the goal here is to minimize the TE, so we'll use a TE as short as possible. That minimizes the effect of T2. And so this term is gone, and then in this case one has a image that is essentially reflecting the equilibrium magnetization, which reflects, as we have introduced in lecture 8, which reflects the number of spins in a voxel. So we're imaging the number of protons per voxel. In this particular case, this is the parameter rho. So images with higher density, spin density like FAT and CSF, have a higher image intensity. However, if we consider the contrast that this can bear, we have to bear in mind that living tissue typically has water content that varies between 70 and 100%. So that is not a gigantic difference in contrast between the different tissues. So it's not a very good way to distinguish the tissues. Nonetheless, it's the physical approach. We want to measure the density of protons. We're measuring a quantity, number of protons per voxel. This is for proton density MRI. So, second question, how is T2 contrast produced now? We'll take again the same operational equation. That's our signal of our spin echo sequence. And now we are looking at the T1 effect. We are now interested in producing a contrast solely on the basis of T2. And so, in this case, for T2 weighting, we don't want to have the effect of T1. So we're going to use long TR to have a reduced effect of differences in T1. We are interested in exploiting just the effect of T2. And so, again here, at 3.5 seconds, we have a fairly long T1 to minimize the effect of T2. And let's say this is sufficiently long that we are not measuring the influence of different T1s, and so we can neglect this term for the following. Now, to measure the effect of T2, one does not want to measure at a short TE, because there they don't differentiate. One wants to use a longer TE to accentuate the differences in T2. So that's this term here. We want to accentuate the differences here. We've pretended that this term is 1, and we don't need to, this term is 1, and we don't need to consider it. So we'll just use a particular T2, and now here the issue is what is the optimal TE that we will be using here to accentuate the T2 differences. And clearly if we use a TE equals 0, we have no differentiation of the T2 differences. If TE is very long compared to T2, then we have no signal and we cannot differentiate either. So there's somewhere in between is an optimum, and this is done by the goal here is to find the echo time at which the transverse magnetization is most strongly affected by the T2 differences. To do this, we do the same kind of variational calculus or error propagation calculus that I introduced in lecture 1 to obtain this solution. So we'll do first, and essentially what it is, we'll calculate the derivative of the transverse magnetization with respect to T2. That tells us how much is the transverse magnetization sensitive to changes in T2. And then we want to know at what TE is this derivative maximal. That's the approach. I'm not going to go through the details here. I'm just going to give you the result. The optimum TE here is when it is at the value of T2. If we have tissues with different T2s, so T2A and T2B, then most likely the optimum TE to use for differentiating those two tissues is the TE that's between the two T2 values, so somewhere in between. So it's not a very crucial requirement, but if your T2s are on the order of 100 milliseconds, there's no point in measuring at 200 milliseconds, so you set it to 100 milliseconds. However, if you're in a situation where the T2s are 50 milliseconds, the 100 milliseconds are perhaps not the optimum choice for T2 weighting. Okay, so in this case, the TE here is 100 milliseconds. Okay, and finally, let's discuss T1 weighting. So we are looking again at the operational equation here for the spin echo sequence, 90, 180 degree. But now we're not interested in having the effect of T2. So we want to minimize the effect of T2. And to do this, like with proton density weighted imaging, we want to have a TE that is as short as possible. So we're using a short TE to minimize the effects of T2. So we'll use something here like 20 milliseconds in this particular example. And then let's pretend that we have been successful, that our T is sufficiently short that we can largely neglect the effects of T2. So we'll pretend that this factor here is 1 and that we'll just gray it out here and it's no longer observable. So now we're interested in optimizing or in looking at this term here. And so the effect to accentuate the T1 effects, one uses a relatively short TR. If we use a TR that's very long compared to T1, we won't have an effect of T1. If TR is very short compared to T1, we're using 90-degree pulses here, then we have no signal. So there's most likely also here a optimum for the TR. So the idea is to use a short TR to maximize the differences in longitudinal magnetization as they are returning to thermodynamic equilibrium. So we have CSF here going slow and we have white matter going much faster. So we'll have some differences here. And in this particular example, the TR chosen here is 600 milliseconds. As a consequence, tissues with short T1 have a higher image intensity because they are the ones who are much further along in their return to thermodynamic equilibrium than the tissues with long T1, such as CSF. So CSF appears dark. Now, again, we can ask, what is the good choice of TR? That's the question. And I'll give you the answer, because we have actually dealt with this already in course 9, and it's a similar calculation that I've introduced in lecture 1 and that we've just used on the preceding slide. And the answer here is not surprising. We're dealing with an exponential return, that the optimum TR to CT1 changes is at a TR equals to T1. We're not going to go into much of the details here. Let's illustrate in the following. We'll illustrate these different contrasts. So here's a T1 weighted image of the head. We can see the tongue here, the nose. This is a sagittal cut, so here's the back of the head where we have the little bump back here. To give you an idea what these TRs and TEs are, I've put them in here. So this is a TR of 510 milliseconds and a TE of 14 milliseconds. Here's now a density weighted, proton density weighted image. So it is a TR of 4.5 seconds and a TE of 15 milliseconds. This is a cut through the head coronally. So we can see the ventricles very bright, the CSF bright, because this is 100% water. It's not very bright, but it's brighter. It's a grayish image. And T2 weighted here now, the TR is 4.5 seconds and the TE is 100 milliseconds. We can see the liquid filled spaces. The CSF, cerebrospinal fluid, has long T2. There's no proteins, no membranes in there, or very little. So T2 is long. They show up as bright. And so notice here that we have the fluid, cerebrospinal fluid here, here, and here. We have long T2 for cerebrospinal fluid and long T1, but the cerebrospinal fluid is dark on T1 because the weighting there favors the short T1 components, whereas in T2 weighted the imaging, the weighting favors the long T2 components. So this is again a comparison of T1 and T2 images in the brain of the same subject. We have the tissue filled ventricles, dark on T1 weighted and bright on the T2 weighted image. Here's an example of a T1 weighted image of the knee, and this is of the muscle, also T1 weighted. So fat typically has a short T1 compared to muscle, so we get good contrast. This is the fat, this is the bone, and here we have a lipoma in this unfortunate patient. So this is showing the fat signal. So we have to remember for water that a short T1 typically implies a short T2, and a long T1 implies a long T2. So even though this is long T2 and this is long T1, the contrast, the way it appears, is different, and this is important because the way we generate the contrast generated in MRI changes the appearance of the same signal, of the same mechanism. Now here's a second example, and this is T2 weighted imaging of MRI of cancer. And one of the features is that cancer tissue has a long T2. This is our metastasis of colon carcinoma. They are here. They are on this T2 weighted image of the abdomen. They are hyperintense, very brightly visible. Here's a T2 weighted image of the brain, a tumor. One can see the bright area here where it shouldn't be, and there is even some difference within that looks peculiar. Here's an example of a mouse with xenograft tumor. So the tumor is here implanted here on the surface. This is the T1 weighted image. Just to give you an idea what the parameters are, 500 milliseconds TR, 13 milliseconds TE. This is T2 weighted here. And again, TE is now 40 milliseconds, TR is 2 seconds. And on the T2 weighted image, one can see the xenograft tumor. It's much harder to see on the T1 weighted image. So T2 weighted images are very often used to detect tumor tissue. Here's again for a mouse implanted with tumor-bearing cells, non-tumor-bearing cells. In the T2 weighted image, clearly the tumor that has grown is very visible. And now on the T2 weighted image, one has very often a contrast that is not homogeneous for a tumor. And what often is done is the application of contrast agents which depict in the brain a breakdown of blood-brain barrier or vasculature. And this is now the same patient here, a T1 weighted image after the application of a contrast agent. And that bears now the question on what are MRI contrast agents, which we'll discuss next.